So our endoscopy patients, those getting an upper endoscopy and the screening colonoscopy, they will get ready for the procedure here, and then they will also recover here and then eventually be discharged. Why don't you step in and we can give you an example of what the room looks like. Nice and bright, spacious. Our little colon stuffed animals in honor of Colon Cancer Awareness Month. Give these to patients, get them at ease, make them relax. But as you can see, it's a very spacious room. We'll start your journey here. The nursing staff will get you checked in, review your medical problems and your history. Modern electronic monitoring system makes it much easier for the nursing staff. And then from here, the staff from the GI lab will then pick you up and we'll take you down to one of the GI procedure rooms. So if you're having an endoscopy or a colonoscopy, this would be the room where we would do the procedure. As you can see, very bright, spacious room, state-of-the-art technology. We've gotten everything up on booms to kind of reduce the floor clutter, so it's easier to transition patients in and out of the room and move them around. All electronic recording by the nursing staff. That makes it much easier. That way they're free to actually monitor the patient and not have to worry about writing in charts. This here is an example of a colonoscope, which we would use to screen for colon cancer. As you can see, very flexible tube, fiber optic. There's a light on the end and the camera. And what I'll do is I'm going to reach over here, just pull down. This is the monitor we watch everything on when we do procedures, and you can see my fingers in the scope. Kind of gives you a visualization of the whole room. But scope's very flexible. There's no pain involved with the procedure at all.
Great. And it is Colon Cancer Awareness Month.
It
so
is.
We want to bring attention to that and awareness. Can you tell us a little bit about who should get screened, when they should get screened?
Well, anybody age 45 and older should be screened if they haven't been already. They've changed the guidelines. So a couple years ago it used to be 50 and older, but we've since, in the last 2 to 3 years, the American Cancer Society and the GI Societies have pushed to get that starting age moved down to 45. And the main reason is not because we're finding more cancer, but we're actually diagnosing it in younger individuals. So we're starting earlier. But also anybody with a family history should be screened, and depending on the age of the family member, that sort of determines their starting point. Okay.
And if they are at the age or they do have a family history, where do they start?
Well, they can start with their healthcare provider or a family physician, and they can be referred over to our office or any gastroenterologist to get screened. Or if they're a healthy individual or you don't have a family physician, you can actually just call our office. We have a dedicated nurse that operates our open access department, and that department is for those individuals that are not having a problem but just need a screening procedure. So in order to save patient time and money, there's no reason for a dedicated consult in the office where the patient has to come in and spend time meeting me just to get set up for a basic screening colonoscopy. Now, certainly if a patient has questions or they want to be seen first, we'll always, allow that. But in order to save patient time and money, we offer this program where we meet the patient for the first time the day of their procedure. But that's after their chart has been reviewed by one of my nurses, and then as well as myself or my colleague, and we give the okay. And then we will meet them here at the surgery center and get their examination done.
And there's some people who are hesitant about a colonoscopy because you hear these horror stories about it.
Right.
What would you say to those people?
It's like a fish story. Everybody always says the fish was this big and it really was this big. It's the same thing with the horror stories. Most people are not happy with the fact that they starve the day before, but you're really not starving. You're just not eating solid food. You're going to be intaking calories and you get to drink liquids all day. It's just not the stuff that we like to eat and drink every day. But there's a purpose for that. So the preparation for the colonoscopy is very important because you want to get a good bowel cleansing in order for the doctor to be able to see the entire colon. If you do not have a good bowel preparation, then things could be missed, small polyps or even small tumors. And that really is the reason why we're doing the exam, is to find those. So if you don't have a good bowel preparation, that sometimes can hinder a good exam.
And are you under anesthesia when you get a colonoscopy?
You are. So it is a form of anesthesia. We call it moderate sedation. It's not general anesthesia. When most people hear the word anesthesia, they think of that where they're on a machine and the machine's breathing for them. This is a very light to moderate sedation. You really have, the medication we use has a lot of amnestic properties, so even if a patient were to open her eyes during the exam, they're not going to remember any of that when they get back to the post-op room. In fact, most patients, when they get back and wake up, the first question out of their mouth is, did we even start yet? And we're already done.
Yeah.
So patients are very comfortable, there's no pain with the procedure, and it's a good experience.
Great. Anything I didn't ask that you wanted to add?
I would just say, if you haven't been screened yet, get screened. Colon cancer is beatable and treatable, but only if you undergo the proper screening procedure.
Thank you for your time today. We appreciate it.
You're welcome.